I'm David Lansky. I'm pleased to welcome you all. I'm the co-chair of eConnect along with Don Crane, who'll be speaking to us shortly. And before we get into the substance of the day and the discussion for the day, we're going to begin with a short video presentation. And I'm going to assume that it's ready to go, and that'll hopefully set the tone for the morning ahead. So if the video is ready, let's start with that. That was wonderful. That is very inspiring and uplifting, catchy. I saw people dancing in the back. That was great. Thank you for producing that and giving us that start. So let me welcome you all to the 2011 California HIE Stakeholder Summit. We gathered here in this room are the people who are going to help take this vision and make it happen. So I hope you look around and see other colleagues and appreciate the opportunity we have to really drive forward a transforming agenda, like we just saw presented to us. As I mentioned, I'm David Lansky. I'm the president and CEO of the Pacific Business Group on Health. And I'm also pleased to serve as co-chair with Don of eConnect, the state HIE body. And on behalf of the board of directors, the entire board, several of whom are here today, I want to thank you all for coming and participating in this summit. We've had a tremendous response to the idea of having this summit and the invitation we put out, as witnessed by the crowd we have here. And we realize there's just tremendous interest and enthusiasm to try to take the vision we just saw sketched and turn it into reality for the patients and the community of healthcare in the state. So today we'll take some strides forward in making that happen. I want to say just a word about why I'm here and why my organization wants to be part of this process. PBGH represents large purchasers of healthcare. So these are very large companies like Chevron and Safeway and Intel, and CalPERS itself representing the state and many other public sector employees. And so together, it's a little bit odd that we are so interested in supporting what's going on here, but I just want you to appreciate that we really see health information exchange, much as the video said, as a critical, foundational, transforming part of making healthcare work better. Our members, our large employers, as you know, are very much affected by the difficult affordability of healthcare right now, the continuing increase in costs, and we're very worried about the quality of healthcare and patient safety issues and so on. So for them, these companies, it's vital that we figure out a solution to this infrastructure that will allow healthcare to become transformed. And as we look at healthcare reform and ACOs and episode payment and medical homes and all the good things that people on the ground want to do to improve healthcare and make it affordable and make it high quality, we don't think that can happen unless we are successful in this room today moving this agenda forward. So the purchasers of healthcare in California are absolutely behind you and want to see you succeed in making a new kind of infrastructure to support healthcare improvement. So on behalf of them, I thank you all for coming and working so hard on this agenda. We also want to thank many organizations that got together to make this event possible. We have a number of sponsors, and you have a nice brochure in your packet today that gives you some information about the sponsoring organizations. Cedars-Sinai, ACS, Booz Allen Hamilton, CAPG, Don's organization, PBGH, the California Hospital Association, Greenway, Public Health Foundation Enterprises, the HIMSS Southern California chapter, and Northern California HIMSS. So thanks to all of our sponsors for helping to put this together. You give them a round of appreciation. Let me just mention the objectives we have for today, and please review the agenda. You'll see a really tremendous group of speakers and presentations for today. We want you to learn, have an opportunity to learn more about the assets and innovations already underway in the state, so you can network with each other and learn about things that you can implement in your own environment. Some of these things will leverage what you're doing, and you can adopt them in your own community. Secondly, we want you to have a voice in shaping the future of HIE in the state. So as you talk to each other and talk to the various leadership organizations here, try to make sure your views are heard, and we can capture them in the work that we're all trying to do. And finally, hopefully you'll have a better understanding of how your project and your community fits into a statewide network of activity. And so this is a convening of the whole state. And hopefully we can begin to collaborate and network and partner together to make this process succeed. The only way we're all going to, any one of us is going to succeed in this environment is by all of us succeeding. One of the magics of network effects is we have to all be part of this network. So please use this opportunity to network person to person as well as technologically today. And finally, let me ask Don Crane, my co-chair, to come forward and say a few words and welcome our first speaker.
Great, thank you very much, David. It is indeed a pleasure to be here today. I am Don Crane. I'm the CEO of CAPG, the California Association of Physician Groups, and I have the good fortune to be co-chair of eConnect with David, and so we're definitely enjoying that, and certainly a pleasure working with David. I thought I would share a lesson we're learning in the field at CAPG right now as our members are applying for Pioneer ACO status. As you know, the final regs just came out for the shared savings program, but the Pioneer program is most interesting because they're going to select some a cohort of 30 organizations across the United States that have high levels of sophistication that are presently capable of managing or coordinating care across the continuum. And this process is providing a really interesting lesson for us, I think, and provides context for what we're doing here today and what we're trying to do in connection with HIE. So, in the Medicare program and also in the commercial ACOs we see coming out across California, the goal really is to bring coordinated care to a fee-for-service population, not HMO, lock-in assignment, but a fee-for-service population where patients can go anywhere they want. And the name of the game to produce savings, as they model this, is to stratify the population and identify the sickest small percentages of the population. In fact, 1% of those populations drive 28% of the costs. So your mother's Cadillac or your father's utilization management, particularly retrospective utilization management, won't do. It's all about stratifying the population, finding the population, and then outreach. And to get that done, that requires an integration of data like never before, both administrative data and clinical data, and getting that work done. And that means HIE. So for those pioneers to succeed, they need health information exchange. And for all of us going forward, whether it's ACOs, whether it's just healthcare reform generally, what we're seeing is that we can reduce admissions and readmissions a bunch and reduce utilization, and we can squeeze some cost out of the system here and there. But to really achieve the level of integration that we want, to truly bend the cost trend to something sustainable, to get to the quality that we want, it's entirely dependent on HIE. So that seems to me is the context for our meeting today and underscores the importance of HIE. So glad to be a part of it. I now get the good fortune to mention a couple housekeeping things. There are 18 tables, display tables located, I think, outside, which we encourage you to visit, that a number of sponsoring organizations displaying some of their information, so please do that. And then I now have the good fortune and pleasure of inviting our distinguished speaker this morning, which is David Maxwell Jolly, the Undersecretary of Program Support with the California Health and Human Services Agency. Our speaker was to have been Diana Dooley, as you may know, but she was called away for business in Washington, D.C. We know how that can happen. But I think we're going to be very lucky to have David speak with us. He has, over the last 18 months or so, as eConnect has started to grow up, provided strong leadership from above as he has helped shepherd our growth and development, and has done a superb job in that. He has a distinguished record for over the last 3 administrations. He was the director of the California Department of Healthcare Services, responsible for Medi-Cal. He was the director of the California Department of Child Support Services, and I think most interestingly, perhaps for our purposes, it was under his direction that they developed the California Child Support Automation System. So clearly some synergies in David's background that I think serve him well as he helps all of us develop HIE. He has a master's degree in public health from the University of Michigan and a doctorate degree from the Pardee Rand Graduate School. So clearly an incredible background, and we're lucky to have David, so I'll welcome you up at this point. Thank you very much.